For over 40 years, we've been told a very simple story. Cholesterol is bad. It clogs your arteries like grease in a pipe, and the lower your numbers, the safer you are. But in my clinic, I see patients with perfect cholesterol who suffer heart attacks, and others with high cholesterol who have the cleanest arteries I've ever scanned. It's confusing, and frankly, the old advice is failing many of you. But the newest medical verdict is finally in, and it's changing everything we thought we knew about heart safety. It turns out, cholesterol isn't the fire, it's just the firefighter. In this video, I'm going to break down the latest 2026 research on what actually causes plaque, why your total cholesterol number is almost meaningless, and the 3 specific tests you need to ask for to know if you are actually at risk. Good day, and welcome to Heart and Health. I'm Dr. Ed, a cardiologist. The new verdict shifts the focus away from the cholesterol molecule itself and toward 2 much more dangerous factors: oxidation and particle size. Think of cholesterol as a passenger in a car. The car is called a lipoprotein. If those cars are large and buoyant, they bounce off your artery walls without a problem. But if those cars are small, dense, and rusty from inflammation, they get stuck in the cracks of your endothelium. This is where the danger lies. The bridge between the old science and the new science is understanding that cholesterol only becomes a threat when your body's internal environment is inflamed. If we don't fix the inflammation, lowering the cholesterol is just a temporary bandage. Disclaimer: please remember that the information shared in this video is for educational and awareness purposes only. These insights are based on emerging clinical data. Never stop taking your prescribed statins or heart medication without a direct consultation and plan from your healthcare provider. Routine 1. The death of total cholesterol. The first major shift in the 2026 verdict is that we are moving away from total cholesterol as a metric. We now know that your HDL to triglyceride ratio is a far more accurate predictor of a heart event. If your triglycerides are high and your HDL is low, it's a sign that your body is struggling with insulin resistance, which turns your LDL into those small, dangerous, rusty particles I mentioned. Your routine should be to ignore the total number for a moment and look at your triglycerides. If they are over 100, you have a metabolic problem, not necessarily a cholesterol problem. By lowering your sugar intake and increasing healthy fats, you can often remodel your cholesterol particles into a safer, larger shape. Routine 2. The ApoB revolution. The second verdict focuses on a marker called ApoB. If you want to know your true heart safety, you must ask for an ApoB test. While standard LDL tests measure the weight of the cholesterol, ApoB measures the number of potentially plaque-forming particles. It's like counting the number of cars on the highway instead of weighing the total amount of rubber. More particles mean more chances for a crash into your artery walls. In the latest guidelines, a low ApoB is considered the gold standard for heart safety, even if your other numbers look a bit high. Your routine here is a simple blood test. If your ApoB is elevated, it's time to look at your fiber intake and your intake of saturated fats, which can specifically drive this number up in certain people. Routine 3. The LPA wildcard. The final part of the 2026 verdict addresses something most doctors never test for: LPA. This is a highly inflammatory, genetic version of LDL that acts like Velcro on your artery walls. If you have high LPA, you could have the healthiest diet in the world and still be at risk for a heart attack or ED because this particle promotes clotting and calcification. The newest research shows that standard heart-healthy diets don't move this number much. It requires specific interventions like high-dose niacin or specific new therapies. Your routine is to get tested for LPA just once in your life. Since it's genetic, if it's low, you're in the clear. If it's high, you and your doctor need to be much more aggressive about managing your other risk factors like blood pressure. In summary, the newest verdict on cholesterol is this: it's the quality, not just the quantity, that matters. Your heart safety depends on 1. Keeping your triglycerides low to ensure your particles are large and buoyant. 2. Monitoring your ApoB count to know your true risk. And 3. Checking your LPA wildcard once to see your genetic baseline. If you've been worried about your cholesterol numbers, I hope this helps you realize there is a more detailed map to follow. If you found this update helpful, please subscribe to Heart and Health. We are committed to keeping you at the cutting edge of cardiovascular science. I'd love to hear from you. What was your last cholesterol reading, and did your doctor test your ApoB? Let me know in the comments below. Thank you so much for watching, and as always, take care of your heart.